I'm Patrick Kanary, and I'm the host of this session of Innovative Conversations, supported and sponsored by the Center for Innovative Practices at Case Western Reserve University. These podcasts are in a series related to larger scale system of care issues. And so today's topic of implementation science is particularly timely, given all of the activity that is going on in our state, even as we speak. I'm thrilled that we have two really wonderful, nationally, internationally recognized experts in the area of implementation and implementation science, and we'll talk a little bit about what that means. I am going to have them introduce themselves. They'll do a much better job of that than I will. But on this webpage, you will see their bios. So do feel free to check out their backgrounds, and we'll go from there. So Suzanne, do you want to introduce yourself, say hey, and what it is that you're involved in that brings you in touch with the wonderful world of implementation?
That sounds great. Thanks for the introduction, Patrick. It's really great to be here as part of this podcast. So as Patrick mentioned, my name is Sue Kerns. I am a professor and research director at the Kempe Center for the Prevention and Treatment of Child Abuse and Neglect. As far as implementation science is concerned, I have a few different roles that bring me to this space. Within my role at the university, I'm also a network partner director for an intervention called multisystemic therapy. And we do a lot of on-the-ground implementation support and work through those activities. I'm sure we'll talk some more about that as we move through our time together today. I'm also deeply honored to be the president of the Society for Implementation Research Collaboration, SIRC. Also would welcome people to check out our website while you're here listening.
We'll post it.
Wonderful. I also am the associate editor for a journal called Global Implementation Research Applications. It's one of a handful of new journals that have come to the forefront to explore issues related to implementation science, and really happy to have an opportunity to see what's being written across the globe as it relates to implementation science. So thank you.
Great. Thanks. Allison, hi.
Hi everyone. Yeah, so great to be here. Great to be with you all today. So I'm Allison Metz. I'm a professor at the School of Social Work at the University of North Carolina at Chapel Hill. Also direct a group there called the Collaborative for Implementation Practice. Previously, I directed the National Implementation Research Network for many years. That's also at UNC Chapel Hill. In my current role, I also direct a certificate program in implementation practice. So our center has a really strong interest in the skills and competencies that it takes to be able to support change efforts in large public systems. So many of the folks that kind of come through our program are managers and leaders in public systems, child welfare, children's mental health, early childhood, public health, and I think that's all I'll share at this point.
Okay, great. Thank you both. So there'll probably be listeners to our podcast that have a continuum of experience and involvement with implementation, all the way from perhaps programs within agencies, within communities, all the way to State Department partners who are implementing large-scale efforts. But can we use kind of a definition to kind of just ground us as we begin the conversation? I know implementation science is this big, but maybe just to kind of have it in our ears as we, go through the kind of the rest of the topics.
Sure. Well, I can tackle that out the gate, and Allison, I don't know if you want to add in some meat on that. But we think about implementation science. We think about how we gain knowledge about what works in bringing new innovations in, whether that's at, as you mentioned, Patrick, at a kind of more agency specific level, or we're looking at large system of care, system of change efforts. but really thinking about it being the combination of what we know from research studies that have been conducted that really look at the various features and factors, mechanisms, different things that are associated with implementation from a research side, and blended with what we know from a practice side of how people are really utilizing the strategies and the different components of the implementation research in the field, but also making sure that that information gets carried the other direction too and informs future research in a nice cyclical way. I don't know, Allison, I know you probably have some ideas for how to flesh that definition out a little bit more.
No, I thought that was perfect. We do really think about implementation science as kind of sitting at the nexus of implementation research and implementation practice. So implementation researchers are identifying those strategies that help us kind of move different programs, practices, policies into everyday settings, and implementation practitioners are really kind of testing out those strategies in different contexts. And so if you have a strategy, around building an implementation team, and that's, supposed to be helpful and it's been identified as an evidence-based implementation strategy, then you have people testing that out on the ground every day, different teaming structures and formations, and figuring out how to build capacity of those teams. And it's really this kind of virtuous cycle between those doing implementation and those kind of studying it that really allows us to have good research and to build a strong science.
Okay, good. I think that's really helpful as we go forward. So I'm thinking, I think about, all the Marvel universe world and the DC universe world, and we talk a lot about origin stories. And I know that implementation science did not just come, full bloom in a moment. What's a little bit of the history that brings us to a place where it's increasingly research defined, modified, like you said, Allison, tested, and put in experiential settings? Kind of where did some of the early kernels come from that motivated us to kind of begin to formalize this a little bit more?
I mean, I can jump into, we'll tag team.
No, I was gonna say, why don't we just start?
which is such a relief when you have like your partner in this. So, I think implementation science, in the way that we think of it now has probably been around for a couple of decades. Some might argue earlier, but I think in that kind of, way we think of it, the modern way we think of it, is probably over the last 20 years. And I think that kind of origin story probably really started with folks recognizing, whether that's researchers or funders, practitioners, that there were things that worked to be able to improve outcomes for different focus populations, and really starting to understand that ensuring that those interventions that worked were actually able to be implemented and scaled in real world settings was much harder than we thought. And so, originally it was this idea that we would kind of do a lot of intervention research, kind of figure out what works, and we would then kind of push that out into the world. We would disseminate that information, and it would just be kind of taken up, and people would start using it. And, I think there's some early folks, like I think about Dave Chambers, the original kind of call for proposals around dissemination and implementation research from NIH really came from, this idea that, wow, we do know about kind of what works around interventions, but do we know what works around supporting their implementation so that they can move from that research study into that community-based setting, into that public service setting, so that we can really make a difference. So I think that's how I think of the origin of it. And I know Sue and I could talk endlessly about how it's grown from that original origin story, but I'd say it kind of comes from that. I don't know, Sue.
Yeah, no, I think so too. I also think about sort of that seminal article that Baylis and Boren wrote, where they has said, hey, guess what? It takes 17 years for something to go from development into the field. And that kind of simultaneously, I think, combined with some of like, I know John Weiss, for example, did a lot of work and kind of like, hey, when we move a lot of these interventions from these more research-based settings and everything, we see something called, and I don't think he called it this at the time, but we kind of call it now, like this efficacy voltage drop, right? It's not as effective when we move things. And so I feel like the impetus for implementation science kind of, it's like, can we do this better? Can we reduce the amount of time it takes for effective interventions that people are already, that are already developed, to get them in the field? But when we get them in the field, can we make sure that they're actually having the intended impacts?
Mhm.
I think that was sort of the origin piece of it. And of course, there's a lot of complexity that's behind that, because it isn't always possible to just take something and transfer it, right? And so I
Right.
think that's where the implementation practice piece really started to inform and say, hey, different community cultures and different agency climates and different all these other things like really seem to matter. Who your coordinated implementation support team is, like, we started figuring out there's
Right.
these elements that really seem to make a difference in this space. And then how do we kind of collect that information? I think that was some of how things got started from the research side. But like Allison said, we've been implementing things for a really long time. And I think, the origin story probably begins with agriculture, right? Like, how do
Sure.
we teach
Yeah.
people new ways of doing things, to better in the betterment for society, to have more, healthy foods available and that kind of thing. And so I kind of lean back into that space sometimes too of, you mentioned this, Allison, that, bringing in other fields, bringing in knowledge from other disciplines and other places. There's a lot of origin for where we are now that's also in business and agriculture and other areas too.
Well, and I think about 20 years seems like a good timeline in terms of kind of this piece of implementation. And I can remember entering that timeline just about a little over 20 years ago, when we started our center, and the center that is in Denver now and at your university, Suzanne. And I thought I probably knew some things about how things worked, and realized how much I didn't know about creating the onboarding process and really maintaining the flight pattern, to use an analogy, because I did grow up in the system where it was, here's a grant, here's a program, go implement it, and 6 months from now we want to see your outcomes, with very little, if any, support or infrastructure in order to really make that successful. So that really resonates with me, and I think probably for a lot of folks in our field. So I do appreciate.
That's exactly what got me interested in implementation science to begin with. It was in the late 90s. I was trained to be a trainer for a particular evidence-based intervention, and like 3 different places they sent me in a row, I had people sitting in chairs that were like, I don't even see kids. Like, I don't know why I'm here. Someone told me I should come yesterday, and just this like, and I thought, what kind of like a waste of everybody's time and energy. Like, there wasn't any forethought into how are we actually going to make this work within our settings.
Yeah.
And so I think that's where a lot of this came from, is just a recognition that, that train and hope model, like, let's just go out and get these, trainings out there and get people ready to implement these things, is really not effective.
Well, and as our colleague Karen Blasi used to say, it is the spray and pray method that we used to adhere to. Just spray the countryside with whatever it is you want, and then just pray that it begins to take root and moves forward. I know that implementation science is not a one size fits all. It's not a here's this version, here's that version, but we have talked about frameworks, or in my head, buckets of implementation science. Is it possible to kind of label a few kind of buckets of implementation work that represent kind of a framework or in a particular approach?
Mhm. Yes, I mean, and I think traditionally when we think of implementation science, we do think of kind of theories, models, frameworks, and now strategies that the field has developed some evidence behind. And I mean, I'm sure we could name some different frameworks, but when I think of very kind of common use of frameworks would be kind of using what might be referred to really broadly as like a determinant framework. And those kinds of frameworks, like the consolidated framework for implementation research or other determinant frameworks, what they really do is they basically identify the contextual factors that happen at multiple levels of a system that can either impede or facilitate implementation. And determinant frameworks can be used diagnostically. So why did implementation succeed or why did it fail? But they can also be used to plan, to guide implementation. So I think they can be, incredibly helpful in that regard. And so kind of the large buckets and frameworks like that would often look at kind of those different levels of context. So sometimes that could be kind of macro, meso, micro. It could be, outer context, inner context, and thinking about the characteristics of those who will be delivering the intervention or supporting its delivery in some way, the characteristics of the intervention itself, the process by which you'll engage in implementation, either through kind of stages or phases, how you'll use participatory processes during that time. These are all kind of, important aspects of determinant framework. And I think that does show, there's so much we could talk about now, but some of those early developments in the field where we moved from kind of this focus on dissemination and trying to push out. We thought of implementation in somehow kind of a narrow way, often around training or things like that. And I think what these frameworks have done is they really opened up a whole new world, that there's actually multi-level influences that are at play, and our ability to both identify them and harness them is what really kind of can lead to more effective implementation. I'll pause there because I could go on and on about how to integrate those with systems thinking and other things, but I don't know, Sue, if you want to jump in there.
Oh my gosh, that was brilliant. That was really good. So the only, I don't have anything, substantive to add to what you were just saying there, but just wanted to reflect on the fact that there are so many frameworks that are, in the field right now. It can be really overwhelming, as you're just getting into an implementation effort to identify the right one. And I don't know how you feel about this, Allison. I think it probably matters a little less like which one you pick than that there is a one that you pick, and that there's something that you're kind of grounding in that's helping to, move through. And if you have your implementation team, like really giving you a grounding space to be asking questions and moving through an implementation process. They have a lot of common elements across the different frameworks for the most part, but they do take slightly different angles and different, you don't want to just, throw a dart and pick one randomly, but at the same point, it can feel a little overwhelming. So I was just gonna.
Yeah. And that leads me to think about, so would this be a correct statement? That the fundamental concepts that support good implementation are similar at both the, I don't want to say smaller because that's relative, but more at the micro level where I'm implementing a particular service in a particular community, versus kind of a macro, we're throwing all the cards on the table and we're going to reshuffle them, and the things that we've done before, we're going to do real different. Are there concepts in kind of both of those areas that are similar? And are there some that are really exclusive, particularly to larger scale implementation?
That's a good question. I mean, I think there's a lot of similarities overall, but the extent of them and the way they show up is really different. I'm trying to think if there's, something that's unique and to like a larger system effort. And I mean, the one space that I think is maybe a little bit, there's a little less clarity. It's more of like an emerging understanding of the importance of, but that kind of communication and collaboration between systems and supporting that when there's maybe, different agendas, different needs, different goals is part, and like how you really get larger systems to kind of have a shared understanding of where you're headed,
right,
and how to solve that problem. I think that can get very complicated in the larger efforts, and requires, I think, some really specific attention. But that's not to say that the importance of communication and collaboration isn't there in other efforts too, right? I think it's like pervasive and all the way through. It's just the complexity of it shifts as you get into larger systems work.
Yeah.
I totally agree with that. And it's so in this way, like it is such a tough question. And I think Sue and I have both probably worked where we are supporting the implementation of an evidence-based program at an organizational level. And then we're also asked to support systems transformation to align with the big policy change, right? And so I think it's interesting for us to kind of think about, how we might come at that differently. I agree with Sue. There's so many similarities to how we come at it. One thing I wanted to add was, if we think about implementation strategies, so there's some like existing taxonomies of implementation strategies that are well known and well used, I think. The majority of strategies that have been identified in the field of implementation science are often at more of that organizational level. And so I do think the field is there's an opportunity in the field to really think about strategies that might exist at that outer context level or that micro level, a macro level, excuse me. So it's just thinking about that, especially as we think to decrease disparities in outcomes and really to advance equity in our work. That really, I think, will involve a stronger focus on what are those outer context strategies that we can, really leverage, whether those are advocacy strategies or policy strategies, to be able to support kind of enduring change in a system, the idea of kind of transformational change.
Right.
It is hard. Like you always need systems change even to support the implementation of a program.
Right.
But I do think that the scale of that, it takes a slightly different mindset going in. I don't know if that, is helpful or not, but I was just thinking about some of the limitations we have around strategies that are kind of tethered to programming.
Right.
And that, I think we're often thinking to transform the systems we work in.
Well, what the kind of the picture that popped into my head while you were saying that is, you can be over here at the macro level, being led by, let's just say state policy direction and an agenda being formulated and pushed forward by the state that requires its own attendance in terms of how is that all going to come together and work. And at the same time, as in our OhioRISE initiative here in Ohio, you also have newly supported Medicaid programs that are being disseminated and helped being disseminated at a broader scale than just having them kind of come about community by community. So you've got this implementation definitely at that organizational program level, and you've got implementation going on at the macro level. That doesn't seem like it's all that unusual, is it? Or are we kind of in our own boat here?
I think it's getting the two to meet and to be aligned, so the idea that we often roll out new legislation or policy, like Sue, I'm thinking about Family First Prevention Services Act, right? So you have all these child welfare systems, doing things to align with that new legislation. But even though that's at a policy level, we have to be able to internalize what that means for practice change. And again, and this is really old school thinking in IS that I think endures, which is that you need kind of policies, big P and little p, to support practice change. And you need, when you're have new practices, you have to then think about how might policies need to shift to support kind of new ways of work. And I think that that's the same on small scale and big scale. But again, it is something that we think about, like that alignment. I think about funders, how they often fund programs, or they fund kind of advocacy work, or lobbying work, right? And those two things are really important. And what you really want to do is fund the package. You want to pull the lever at each system so that we kind of have that full alignment. And when that's done, that's when you can maybe hopefully see population change or people actually truly benefiting from that.
Right.
But these are complex systems that are so messy. And the idea that we could get like beautiful vertical alignment in systems that are really often horizontal is challenging. I don't know. Yeah.
Yeah, I know. I think that's really right. As you were talking to, I was just reflecting, people are implementing right now. They're implementing what's happening right now, right? So anytime we have changes that are happening at any of these levels, right? In some way, we're asking people to adjust what's currently happening to whatever that new thing is. And there can be unintended consequences in that, in that shift and that change. And so for me, what that really brought up for me is the importance of what your team looks like and who's informing these efforts and thinking, because a big P policy change that benefits a certain way of thinking about things, and Family First could be an example of this, right? Can cause all of these other, other stream kinds of issues, and who has access to funding and different things, driving practice elsewhere that is already happening, right? And so it just gets very complicated.
Yeah.
But that was brought up for me as you were talking.
You're a systems thinker. So you immediately go to this idea of kind of ripple effects and unintended consequences. And I was on a call recently where we were talking about a big implementation effort. And I had a colleague ask, what do you think might be the unintended consequences of this moving forward? And it sparked just a very deep conversation from some important kind of managers and leaders about what that might look like in the system. So I think just asking that question, as Sue has, is basically this kind of pulling in systems thinking to more traditional IS work. And I think that was just this really nice example.
Yeah, that makes a lot of sense to me. The idea of asking that very strategic question, it can be asked in a variety of ways. One is what might be the unintended consequences. The other might be what might be the negative outcomes of this adventure. What would obviously be the positive outcomes? What would we see if we were doing this, quote, right? And what might we see if we're stumbling? What would be the red flags that would tell us perhaps we need to tune this a little bit better? Yeah, I think those are really thoughtful ways of thinking about it, and that kind of marriage of implementation here and implementation there and everything in between really needs to come together. And that is very challenging work. So I don't know if pushback is the word, maybe critique, maybe critical observation in the field. So, like we said, we've been unfolding this approach for 20 plus years, at least primarily in our social services, human services areas. Where have maybe the challenges been to that, or the challenge to that? Just because most things that we try to do have those, both the yin and the yang of implementation.
Yeah, I know we were talking a little bit about this in our kind of warm-up conversation. I guess I'm pulling the curtain back. We did have a little bit of warm-up. I think, it's so important to have like nuanced conversations about this, I think that because implementation science did develop alongside the evidence-based program movement, it's much of the strategies that have been kind of tested and identified are kind of tethered to that type of work, which has value. It has value in doing that. But I think as we've kind of grown as a field and also focused on, again, how we can advance equity in our work, how we work more closely with communities, what our participatory processes need to look like, it's possible, and there's been some writing about this. I think it was Aaron Lyon that might have written about this as part of an article on human-centered design and implementation. But this idea around focusing so much on kind of fidelity to a certain approach that we may be doing that at the expense of what's really sustainable. COVID has showed us a lot. I think a lot of what COVID's shown a light on, these disparities and these workforce challenges existed before COVID. And then so I think in some ways, though, what it's done is it's at least reignited a conversation about how it is that we work with systems to be able to ensure feasibility of implementation, that we have kind of a shared mental model, a shared sense of beliefs and assumptions about the work moving forward. Those things are often totally implicit, and we don't see them, and that we're really focused on kind of external validity and what it is we're implementing. And so I know that's a bit about mixing the what and the how, but because the how, implementation science was so initially connected so tightly to manualized evidence-based programs, which again have value. I want to, but I think it's that kind of untangling of them, so that we can also start to think about what might be the power of implementation science that we've yet unrealized, because we haven't so much tested it out in terms of community defined evidence or place-based initiatives or systems change. And how is it that we do a better job of integrating IS methods with those participatory processes, or with that systems thinking that Sue just demonstrated so beautifully? Like, how do we do that so that when we are looking to support implementation of something other than a manualized program at an organizational level, are we ready? Are we ready to support that? Do we have the tools to be able to do that? Can we build out those strategies at that outer context level? Can we think about how we are centering equity in the strategies that we choose? So those are just kind of some initial thoughts around that.
Yeah, I mean, that was beautifully said. And I think, as you were talking, this idea, there are a few different ideas that were kind of floating through my head as you were raising that, and especially this importance of, who's driving the car, the boat, or whatever the word is, on the implementation, who's on your team. Are you really centering it in community and what, community needs are? If there are adaptations that are needed for whatever it is that you're implementing, is that done, what is the process? Is that
Mhm.
done thoughtfully? I've been spending a lot of time too, thinking about how much, so my field is children's mental health, and there's a lot of funding that's actually coming in now to support a range of different types of aspects of children's mental health, especially post pandemic. Millions of dollars coming to communities to do different things, and they're being asked to achieve a lot of different outcomes, reducing youth suicide, substance use, we have anxiety, all of these different challenges, also academic achievement gap, closing those gaps, all these different outcomes that have impacts. And so communities are, at least in my experience, are rarely just implementing one thing, right?
Yeah.
They're tackling a lot of different things. And so how do we, really do capacity building at a community level that's sort of program and practice agnostic in a way, but sets up kind of that foundation so that as new things kind of are coming in, or there's considerations that are made, that the community really is able to own that process and engage in what's needed to address some of these outcomes that are really concerning communities across the country right now. I'm sure it's no different in Ohio. And so, that just kind of was what raised up for me as you were talking.
Really, work and implementation, workforce, is so critical. Like, our center is very focused on that. Thinking about Julia Moore's work. There's a groups of us, I think, that are really focused on what it is to build a workforce that can support change. And evidence use. I think that's absolutely right. So, I
think that's a great point. Well, to go back to my airplane analogy, as we glide to our landing here in our discussion, maybe we could just kind of wrap up with each of your thoughts around, so, what's next in IS? What's the future? Where are things headed? Are there emerging trends that are really beginning to capture people's thinking about, now where do we go with this, or where does that fit? So kind of, a little bit of forecasting from where you're both sitting at this moment.
That's fun.
I know. Do you want to go first?
I was like, no, you go. I think we're going to each go more than once.
Probably. I think that's probably true. I think there is a lot of energy right now in really unpacking ways of knowing. How do we know what we know? How are we grounding that in lived experiences of communities, of people who are experiencing, the different things that we're trying to address in our society. And the space that conversation just opens up, I think, is really exciting. We have different research models that are emerging that help unpack some of that. I think there's a lot of practice models that are emerging that are helping to guide some of those deeper discussions. But, even, Allison mentioned a few times during this podcast, this focus on equity and, how do we not just think about it from a individual perspective, but really as a collective whole, and doing right by all of the people that are in a community or in a area. And how do we evaluate that? And I just think that's, to me, a very exciting next, and I wouldn't even say it's the next frontier, because, Allison and I have been doing a ton of work in that area already. There are people who are writing about it but I see that as sort of where the next phase is, at least in my own work, of really trying to unpack that piece a little bit more.
Great.
I'm so happy that Sue has a leadership role with CERC and is able to have us really just as an implementation science community start to think about opening up those spaces, as she said. So I'm so excited about the future of implementation science. I think there's so many things. One, I think it's important, to stay the course with some of what's happening. I think it's really, really great work. What we just mentioned earlier, I think workforce development. And when I think about workforce development, I am thinking about those supporting change. I think for a long time when we were kind of training an implementation science workforce, those were implementation researchers that were training, which is great. I do research too, but a lot of the training is for researchers and understanding hybrid designs and I think that's fantastic. But I also think that there are a group of people that and Abe Wandersman talked about this with the interactive systems framework.
He did.
Years ago, 2008, I think. But the space in between, have practitioners delivering services. We have kind of researchers kind of studying these things, but we have this space in between. Those of us that really help support systems to change, we either are external to that system, or there are folks in those systems whose designated job it is to help kind of incubate and implement and scale innovation in their system. And more you see divisions like that in public systems. And I think really supporting this group of professionals, especially, and just bringing them into the forefront at implementation science conferences and in the literature. I mean, if I have, however many years left in my career, that will be my focus. And I also think, because I think the virtuous cycle only happens if we start to really pay attention to those that are on the ground and really supporting that. And then I guess finally, I noted this interest in workforce and competencies. I'm very interested in the relational aspect of implementation. So, you think about all the readiness assessments we have, none of them really assess things like psychological safety, trust, these things that everyone we know. Every time I talk with Sue, we all know implementation moves at the speed of trust. Yet we don't really study it. We're so blessed to be studying it now and to be trying to operationalize that construct for the field and to think about, are there implementation strategies that build trust among implementation actors? Those are questions that would do a great job of kind of bringing closer together the research and practice of implementation, because everyone on the ground will say relationships matter, trust matters, psychological safety matters. But we don't talk about those strategies or study those. So I think stay the course with things we're doing, and let's bring in some of this other work that I think is so compelling, especially in service systems that we work in where no one feels safe. Families don't feel safe. Practitioners don't feel safe. They're afraid they'll make mistakes. Leaders don't feel safe. They're afraid of, decisions they make, or, there's this lack of safety in so many of the systems we work in, because politics and funding. And so how is it that we center the human experience in implementation and do it rigorously? Bring the research to bear on that. And I think then we're going to start to really build things out.
I love that. In fact, I'm going to plagiarize implementation moves at the speed of trust as my little narrative that's going to go along.
Okay. I feel like so many people have said that. Sue's probably said that to me. Yes, so right.
I won't take credit for it, but I may, I think it's a brilliant concept. I mean, I think it really says a whole lot in one chain of 4 or 5 words. I love it. I love it. I hate to say this, but we are at our kind of ending point here of what's really been a great discussion. I'm just going to ask, no pressure. Any other final points you want to make? Anything you want to underscore that we've already said that you want to kind of go back and put a bold under? Now would be the time to do that. And if not, it's totally okay.
Yeah, I can't think of anything. I just want to express gratitude, Patrick, for inviting me to be part of this panel and get to be here with Allison, who's top of my list of favorite implementation people.
Same here, we're like in a mutual admiration society.
Yes,
If I see Sue's
absolutely.
name on an email, the answer is yes, always.
Vice versa. But it's
Perfect.
just been really, really enjoyable. So I just wanted to extend gratitude and thanks.
Great.
Yes, thank you so much, Patrick. And I feel like Sue and I bolded a lot. We bolded equity, we bolded lived experience, we bolded things that I think the field is going to be endeavoring to impact as we move forward.
Well, it's been a total pleasure to spend this almost 45 minutes, a little over 45 minutes together. I've learned a lot, as always. I know the folks that are going to listen and watch to this will as well. And so with much appreciation from Ohio, thank you to North Carolina and to Colorado, and to Suzanne and to Allison for participating. I really do appreciate it. It's been a pleasure.
Thank you.